Happy Monday, happy day, happy minute, happy hour. How are you today? How's it going? I've been quite interested in the advancements of tech. We can see it in our day to day since the start of the pandemic. A lot of people are saying that the pandemic is like the post-pandemic, unless the WHO or whoever declares that the COVID-19 pandemic is over. We're still very much in it. That aside, in or out, there was a pandemic, there is a pandemic, there, however you want to look at it, but whichever way, one thing that is certain is that from 2020 to date, there has been a lot of advances in tech and the digital space. I actually wanted to have an opportunity to reflect and go through just some key things that have happened in the pandemic so far. But my interest relates to health. And so I'm going to cover a little bit of digital transformation in healthcare. I'm going to talk a little bit about that and then talk about digital transformation in a post-pandemic world. We want to say a post-lockdown world. Read into that as you. And then I'm going to end today's episode looking at some top 10 tech trends for 2022 that everyone must be ready for. That's how I'll end it. And I won't really delve into each specific trend, but it's just an overview. However, I will put links in the episode description so you guys can read further or get into it further. So I think, as I said before, it's very clear since 2020 to date, there has been some level of digital acceleration. You probably have noticed it in the day-to-day. Increased uptake of QR codes. That reminds me, I have a paper that I need finalized that's on QR codes, and it's very interesting, but I'm just working on that paper to finalize for submission. And anyway, so let's talk about digital transformation. Is the process of using digital technologies to create new or to modify existing business processes, culture, or user experiences. And this is to meet changing business and market requirements. Digital transformation is a way of reimagining a business in a digital age. Digital transformation in healthcare, we're applying these changes and the uptake of digital technologies in a healthcare setting. And it is very, very clear that COVID-19, the pandemic, has accelerated these trends of use in healthcare in a variety of different senses. So healthcare from a patient perspective, from an industry perspective, from a healthcare professional perspective. And I read this article, it was Deloitte Insights, and the Deloitte Center for Solutions, they collaborated with an institute called the Scottsdale Institute, and they wanted to better understand how health systems were using digital and digital platforms and digital services to transform healthcare. They conducted a survey of technology executives of 25 health systems. They interviewed 5 health system technology leaders and then facilitated a panel of discussion with technology leaders from 3 health systems. I'm just going to read out a summary of their findings from the survey. 1. Health systems consider digital capabilities a path to fundamentally transform their relationship with consumers. Now, please note the word consumers. We have to remember that healthcare is a business. Okay. Point 2, while the digital transformation journey is long, health systems are focusing on interim milestones to show value. Point 3. This is from their key findings from this. Key finding number 3, that's what I should say. Talent, data, and setting key performance indicators, also known as KPIs, are challenges to overcome in addition to budget. Final key finding from the survey, an executive champion is key to transform digital transformation success. That's very interesting. So this is just really highlighting their key findings from the survey where they wanted to find out how and get a better understanding of how health systems were using digital to transform healthcare. Telemedicine is defined as using remote diagnosis and treatment of patients by means of telecommunications technology. This was something that was being explored, was something of consideration. There was lots of research about how we can implement telemedicine into a patient's day-to-day and, as part of their care. And then more relevant to my interest with digital and digital pharmacies, which is where you're combining the digital revolution with the traditional brick and mortar pharmacy. And it's looking to see how digital tools and technologies can be used to improve pharmacy businesses, pharmacy practice, and patient care. Now, my interest in telemedicine and digital pharmacy came together with this idea of remote 3D printing. Now, okay, we have a paper that's under review. We're just waiting. Let's send positive thoughts to reviewers 1 and 2, please. Accept the paper, please. We're just waiting for final comments that the paper's been given the go ahead. And if that is the case, actually, I should be able to give an overview of the paper, hopefully in the next episode, if it's accepted in the week, but if not, whenever it's accepted. The idea of you've got telemedicine and you've got digital pharmacy, and it's thought that 3D printing fits as part of the last bit of the telemedicine cycle. These are the two areas that, in terms of healthcare and in terms of as it relates to like the day-to-day, telemedicine and digital pharmacies, the digitalization of these services, these platforms, and the uptake of something like telemedicine, that's dramatically increased over the last couple of years. So if we're now, as I said, if we're now going to look more specifically as digital transformation in healthcare, there are some things to consider. And this is consideration based on patient experience, or if you want to say consumer experience, over the last couple of years. So there's been a rise of on-demand healthcare. Patients want healthcare on their own schedule, right? The importance of big data in healthcare. So big data, you hear this all the time, but big data, essentially, if we're adding big data in healthcare, it can help to lower the rate of medication errors, help to facilitate preventative care. You can have more accurate staffing. Another thing that is for consideration is treating patients with virtual reality. I've seen in some schools of pharmacies and even medical schools where they are learning to, like, this is incorporated and added into the curriculum. How do you engage with patients with virtual reality and augmented reality? I was interested in augmented reality years ago in the context of art and using that as a way to engage people with art, but in a different space. Okay, what's next? Things to consider: wearable medical devices. I say that looking at my Fitbit. It's not sponsored. I always have to say this clause. This episode is not sponsored by, but yeah, more wearable medical devices. There's even been an uptake of people, wearing more wearable medical devices so they can monitor their own health. I mentioned preventative care, but what about predictive care? There's things to consider there. So using predictive care and using digital transformation to support predictive care, this can give like predictive analysis that could help businesses of any size determine when to hire temporary staff due to impending outbreaks of colds and flus that could result in worker shortage. Then the famous artificial intelligence. So it's like, these are things to consider. The advancements in AI can have nurse robots. Anyone who follows me on Instagram at Dr Bahijja Raimi-Abraham. No, what's my Instagram? I every so often have a bit of an obsession about robots, and I talk a lot about them taking over the world. And so actually, that reminds me, during my pre-reg, I remember, so I did my pre-reg at Guy's and St Thomas's Hospital, called Guy's and St Thomas's NHS Foundation Trust. This is a form of 2 hospitals in central London. And during my pre-reg. So after you study pharmacy, which is a 4-year degree, and then you do your pre-registration year, which is usually 1 year, and you can do that in a variety of settings: community, hospital, industry, primary care trust, which is now called CCG's, Clinical Commissioning Group. So I had a strong interest in hospital pharmacy, and then also these clinical commissioning groups, which is like medicines management, but in a what we call primary care setting, so community setting. So I did my Guys in St Thomas's for 6 months, and then the other 6 months I was in a primary care trust, now called CCG. And in St Thomas's Hospital, it was like a big deal because in the dispensary they had a robot. I was like, oh my gosh, the robot! And it was like such a big deal. You get a tour of this robot. It's not as you'd expect it to look, it's just more of a robotic. And you would see it and it would like pick up it was amazing. You'd be so like, wow. So now we're looking and how increasing the uptake of AI, things like nurse robots, hospital droids that will be designed to assist human nurses with routine tasks such as restocking supplies, things like that. Then also in a different sense, not just the robots, in-person robots, but you've got chatbots, virtual health assistants as well, which I think a a lot of patients are getting, and people in general are getting. Another thing to consider, blockchain, that's meant to have a promise for electronic records as well. And then even for the healthcare professional, being able to look at, have health in the palm of your hand. So as a healthcare professional, being able to access patient records just in the palm of your hand on an iPad and things like that. So those are things to consider. So there's this very interesting article that came from MIT Sloan School titled Digital Transformation After the Pandemic. The first part of the article is really interesting. It says why it matters. COVID-19 upended many outdated assumptions about digital transformation. Now companies should focus on these 4 initiatives. So in this article, it talks about digital transformation after the pandemic. I've already made my comments about after the pandemic, but anyway. But what is interesting is that the article lays out assumptions that let's just say society has made that we need to challenge. Westman, who is a senior lecturer at MIT Sloan, has stated and listed out these assumptions. Okay, assumption 1. As I read these out, see if you agree with these assumptions and then the reality. Okay, assumption number 1, customers value the human touch. Reality, according to Westman, COVID-19 proved that a well-architected digital experience can offer an equivalent or even a more personalized transaction than an in-person engagement. What are your thoughts? Assumption number 2, regulation inhibits digital transformation. I have to say, I had that assumption as well. Reality, okay, during the pandemic, highly regulated industries like healthcare were open to addressing barriers like privacy concerns for much needed service like telehealth visits. So telehealth, telemedicine. Okay, assumption number 2, it's prudent to be a fast follower. Reality, evaluating others' innovation efforts before taking action on your own wasn't an option during COVID and isn't a good idea going forward. Companies that are operating from this playbook during COVID-19 were more likely to lag behind competitors and miss opportunities, putting them at higher risk for business closures. From what I'm understanding of that, I feel like there's a sort of carpe diem. It seems that, I don't know. That's an interesting one to dissect. Okay, the next assumption, IT can't keep pace with digital transformation efforts. Reality, tech organizations across every industry stepped up to keep operations going and revenue coming through. The last assumption, people won't pay full price for digital only. Reality, consumers paid for digital products and services and will continue to do so post COVID-19. What are your thoughts? What are your thoughts on that? It's interesting. The first one, customers value the human touch. That's the assumption. And then the reality being that COVID-19 proved that, if you have a well-architected digital experience, this can offer an equivalent or even a more personalized transaction than an in-person engagement. And then that first assumption linked with the last one, i.e. people won't pay full price for digital only. Ooh, what do you think? I feel that I was in the bracket, in the camp of, before the pandemic, digital, is viewed as, not as viewed as it should be free, but I think we definitely all had some assumptions, but having had to switch all my lectures from in-person to digital, let me tell you, digital is actually harder work at times because, memories, but very interesting. Yeah, it's very interesting. I'm not sure. I'd be interested to know your thoughts, if you agree with the assumptions, if they resonated with you, and then what are your thoughts on the proposed reality? Let's see. Okay, so coming to the end of it all, I'm just going to run through this list of the tech top 10. This was from Forbes article. I'll put the link in the episode description so you can delve into it a little bit further. To end this episode, the top 10 tech trends in 2020 that everyone must be ready for now. 1. Computing power. 2. Smarter devices. 3. Quantum computing. 4. Datafication. 5. Artificial intelligence and machine learning. 6. Extended reality. Interesting. 7. Digital trust. 8. 3D printing. 9. Genomics. 10. New energy solutions. What are your thoughts? Let me know. Drop me an email, info@mondaysciencepodcast.com, or you can put something in a DM on our social media platforms.